Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me on this episode is Murali Gandhirajan, the Global Healthcare and Life Sciences CTO at Snowflake. We were able to talk in depth with you and other technology organizations in the healthcare space on stage at Empower 2024, so really looking forward to this talk today as the role of AI in healthcare has evolved even further since that discussion. Really happy to have you here, Murali.
Justin, thanks for having me. It's an absolute pleasure to be here.
You know, I've heard you say that AI can do three things: assist, augment, and accelerate. I want to dive into each component of this trifecta, but first, give me a high-level idea of what you mean here.
Sure. I mean, if you look at any technology, right, and if you wanted to see how that technology can be used to better address the challenges in a business, industry business capability, we have to first understand what that technology is capable of, right? And if you look at this generative AI, large language models, it has capability to do natural language processing, which is ability to comprehend and process vast amounts of information in a natural language that we typically speak. The second is natural language generation, which is the ability to generate content. So the technology is now able to not only comprehend natural language, but it's also able to generate content in a natural language. And the third one is its ability to correlate. Right? You have a context and you have a reference data set or a corpus of information. Your ability to correlate the context with the information in the corpus, and then ability to reason. Right? And if you put all of this together, this is essentially where we can see, okay, now that this technology is capable of doing many things, how can we really put this to use from a use case perspective? And the way I classify that is, like you said, assist, augment, and or accelerate. And the way assist means, you as a professional in your line of work, focused on a particular industry, particular business function, we always do things. But a lot of the stuff are manual in nature. The question then is, can we use this technology to actually assist us in doing that task for us, right? And that is assist. And augment is AI playing a co-pilot at best, really working side by side humans, surfacing up not just information and insights that a knowledge worker typically uses. And think of that as like, hey, I have a technology that is augmenting me as a knowledge worker in whatever I do from a line of business perspective, right? And then accelerate is about how do we do what we do in a much more productive way, right? And that's how we look at these use cases, and a technology that is capable of doing many things are better suited to do all of these things.
Okay, so now let's kind of go into each one of those three in a little more detail. Want to start with assist?
Yeah. Let's take a look at assist from a capability of, can this technology help us to automate or eliminate some of the manual tasks that we do, right? The classic example is the ambient listening technology that we have seen as a use case getting widely adopted in healthcare. It's basically the technology AI listening to a clinician and a patient conversation and ability to do a speech to text. And the models are very trained to understand the clinical vocabulary. So when it's really doing the speech to text conversion, it is actually far more accurate when it's specifically translating medical terminologies, right? And think of this as a AI playing the role of a note taker. And that is basically eliminating a manual task from a clinician's workflow perspective, significantly reducing the time that they spend on a documentation burden like that, right? That is one example. The other example, would be AI playing a role where, let's take a look at care management. And care managers always take a care management template, take a look at the member, and then come up with a contextualized care plan for the member. Right? This is about taking a template and then looking at the data and then generating a customized care plan for the particular member. And AI can actually assist in reading a template, understanding the data of the patient or the member, and then drafting up that care plan, customized or member-specific care plan for the care managers to then roll it out to the members, right? Two classic examples. There are just tons of opportunities, right? Just to give a couple of examples, right? A great use case, in my opinion, Assist is how we will look at, what are all the packets where we could deploy a capability like this, which then, adds up from a productivity perspective.
Yeah, and this is probably one of the more common of these three that we're all using it in some capacity today. But looking now at the next part of this trifecta, Augment. What are some examples of how that will look with healthcare and AI?
Yeah, remember, Augment is more AI augmenting a knowledge worker, right? So looking at it from that lens, this is about AI coming up with insights or suggestions. Let's take a look at pathology or a radiology workflow where a pathologist or a radiologist really goes through as part of their workflow, reviews medical images, understands what's really going on from the patient's medical image perspective, and then comes to a conclusion on, okay, this is possibly what is going on, and here is how I'm going to draft up that pathology or a radiology report. And AI and the large vision models in the space is now playing a large role in taking a first stab at reading those medical images and coming up with insights that then being used by radiologists and pathologists to then draft up, right? So this is not replacing radiologists and pathologists, but radiologists and pathologists are using AI as a co-pilot to then better take clinical decisions and confirm or deny or come up with the right fit recommendations for the patients. That's one great example. The other one could be AI being used. Let's take, for example, a population health management as a process flow. As part of the process flow, population health managers always looks at tons of information. If the patient panel is large enough, then they are often gets lost in terms of who are the right patients that they should be focusing on at any given point in time. The point then becomes, can we use AI to then proactively go through what is going on from a recent health development perspective across the patient population and comes up with some sort of a guidance or an indicator, or hey, these are a bunch of patients who have recently had some experience, understanding some of their history. These are possibly the patients you may want to be focusing for so and so reason, right, from a clinical intervention perspective. And that to me is a huge knowledge augmenter, because as a population health manager, you need some direction, right? When you start a day, when you're really looking at your patient panel, it's absolutely a blessing to get and have somebody saying, hey, here are some of the nudges that doesn't make sense for you to see are these the patients to engage. And if the nudges are right, then it's going to make population health manager life much more easy.
Well, and I think you hit on a great point there too, is that in this scenario, no one is being replaced. People are not being replaced. This is simply augmenting the way the work is done. So I love that. And now let's look at some examples of the accelerate component of this.
Yeah, think of accelerate as more of, we are really looking to do something, and can AI technology really help us to do that in a much more faster way? And the classic example is, oftentimes in healthcare settings, more so in the research and also in the clinical settings a little bit, people search for references from a medical journal, for an example. Searching through a medical literature knowledge base such as PubMed, it really takes time, right? So you have to go to a website, you have to do the search, you have to really look for certain articles where you may find some relevant information that you're looking for. Go through each of those medical journals to then understand the information that you are looking for is actually present or not. But today, with the technology like AI, you can seamlessly ask a question. The technology then prunes through the PubMed articles and then comes up with the relevant article that has content. But here is the kicker, right? It also summarizes content and draws out correlations to the context that you're looking for. So imagine a 2-hour exercise of finding through relevant evidences from a medical journal is like a 15-minute away now, right? Or a 15-minute analysis. Think of this as a productivity play, right? It is truly helping us to accelerate what we do, right? And there are many such examples. But if you ask me, all of these assist, augment, and accelerate examples that I was giving, these are all point examples, right? AI, can you draft something up for me? Can you search up something for me? Can you summarize something for me? Can you generate nudges for me? But if you truly want to make a broader impact in a business process, we need to look at accelerate as something that leverages many of the assist capabilities, complements it with augment capabilities to then say, here is how I will disrupt a business process end to end, right? So the opportunity is humongous across these three dimensions.
Well, you teed up this segue perfectly. So how do all of these examples come together, and what is a real business impact example that someone could use to relate that to?
Yeah, great question. Let's take the example of reducing cost of care. It's a business imperative that every other healthcare organization is going after. And let's take a look at a scenario where as part of the cost of care initiative, we are really looking at high cost patients or members, and and really looking to say, who are these patients? Why are they high cost? Why are they consuming a lot of healthcare? What is really going on from their perspective? To then say, how can we proactively intervene and engage them from a health perspective to then reduce the cost of care, but also truly reduce or improve their health outcomes, right? So from a context of this end-to-end process, it usually takes 8 or 10 steps to get this process done. First step is to understand the high-cost claimant. So that requires a SQL query into a database. You retrieve the high-cost members. Once you retrieve them, you need to understand what is really going on. So it is about doing analysis of their diagnosis, procedures, have they missed any screenings, and so on and so forth. That's an analysis that typically a business analyst or a cost of care analyst does. Only then to surface up some themes on, hey, here is what I think is going on with certain specialties, certain diagnosis procedures, some missed screening themes. Then say, okay, should we look at this as a care management program intervention, right, for this particular scenario? Then comes, okay, how do I then identify the members that who gets qualified for a scenario like this? Then you go into the cohorting process of defining inclusion criteria, exclusion criteria, really identifying and understanding the member or a patient population to go after. Then deciding what is the right fit care management intervention given the diagnosis procedures and the specialties and the scenario. Then comes, okay, how can I launch the campaign, right? I was talking to a healthcare executive about this whole process of the analysis taking probably 8 to 10 days time. Talking to the executive about how agents can potentially help reduce that. And that executive's reaction was, you'll be lucky if you'll be able to get this done in 8 to 10 days, right? The current process is so elaborate and intensive. Then we talked about, can we apply agentic AI into a process like this? What if we have an AI agent that sits on top of the corpus of claims and the structured data of the patients? We bring in the unstructured data about the patient, like the clinical notes and any interaction notes. We throw in care management plan templates and the necessary tools that an agent typically needs to come up with the customized care plans, right? And also do an integration into campaign management systems as a tool. An agent then can operate seamlessly across these 8 to 10 steps, where you start by asking a high-level question on, hey, give me a high-cost claimants in a particular 2-quarter time period, and tell me, what are the diagnoses and procedures, and why do you think, these are high-cost claimants? The agent then comes back with its own analysis of, hey, here are some of the high-cost members. Here is what I think is going on. Then we can use that to say, hey, okay, I really understand what is going on now. Now I really want to go and get the member population, right? But not only that, once you get the member population carved out from a cohorting process, you can ask the agent to perform next step of coming up with a customized care management template and then push it into a care management application, or even some CRM systems to initiate that campaign. All of this done in 20 to 30 minutes time, cutting down from 8 to 10 days time, involving 6 different skill set people. That is accelerating your business process, right? What I call it as infusing AI across business functions. And this is a classic example of how an AI can truly transform and drive productivity across the chain.
It's great to hear an example that is truly end-to-end, but with all this, the benefits that come from AI in healthcare, there is a big piece around data governance, and that's critical when you're using AI in the healthcare space. How would you recommend that healthcare organizations approach data governance?
The first and foremost thing is we cannot separate out AI and data when we really want to provide an end-to-end governance, right? So that's the first construct of looking at governance. We have to look at it as data plus AI governance. The only way to look at, or the best way to look at data plus AI governance is bringing AI to the data. When you have AI sitting right on top of the data, where you have right level of access controls, where your data is secured, you have clear definitions on who has access to what data. Thereby, you are naturally extending that construct to the AI, right? If I, as an analyst, does not have access to a particular patient panel, right, a population of patients, even if I use an AI technology to or an interface to ask some natural language question, I should never be allowed to get access to that data. So layering in that AI on top of the data where you have access controls is essentially how we will make sure that when the AI is consuming data, when the AI as a tool is being used by the end business users, you are actually trickling down all the right levels of access controls to a point that you can be safe, you can be confident, right? That's one dimension in terms of data access controls. The other aspect is who has access to use AI. So defining access controls in terms of, hey, here is a bunch of users. The bunch of users can use AI, but how can they use AI? Right? So providing guardrails on how the AI is being consumed by business audience is also super critical. So it's about security. It is about the access controls to the data. It is also about the access controls to the AI capabilities in itself. Right? That's how we stack up the capabilities, and that's how organizations can look at from a framework perspective to scale AI applications across the board. And then I have not touched upon observability. Observability is super important. It's about measuring the effectiveness of an AI application. And so you have to combine the governance and the observability to actually truly roll out applications that resonates well especially in a regulated industry like ours.
So, with the guardrails, there's certainly a way to make sure that you're infusing AI in a safe and secure way, but there is still some apprehension from people across the healthcare space with really leaning into AI use. What advice would you give to those who are more on that apprehensive side?
I think the best way to get started is to look at an operational use case. And if any of the organization is in the business of providing services as a things in the market, start with an internal use case where you can pilot it safely. You can choose an operational use case where you are really going after productivity play rather than letting AI take decisions on behalf of a business process user. I think that's a safe way to get started, right? I mean, that kind of eliminates the need to be, oh, should I be worried about impact, right? What if I get questioned on some of the capabilities I rolled out? It's a much easier way to start out. Once you start seeing success, once you firm up your frameworks around the governance, the security, and everything as part of some of those initial use cases, you can then be confident of scaling it to harder, much complex use cases.
I think that's a great takeaway to end on. Murali, as always, it's wonderful to sit down and talk to you. Thank you so much for the insight today. And for all of our viewers tuning in, be sure to follow along for more conversations with innovators who are truly shaping the healthcare landscape.